Learning Unit Surveillance, Monitoring and Evaluation for Malaria Elimination. Training in Malaria Elimination to Health Workers in Ethiopia. Outlines, Learning Objectives, Introduction to Surveillance. Definition of key term, Surveillance system in 4 phases of Malaria Elimination. Function of surveillance, data recording and collection tools in optimization phase. Reporting format of optimization phase. Data analysis in optimization phase. Malaria monitoring and evaluation of malaria surveillance. Learning objectives. At the end of this unit, the participants should be able to define key terms and the case definition related with surveillance for malaria elimination. Explain surveillance system at 4 phases of the malaria elimination. Explain the different functions of surveillance. Use the data recording and data collection tool of the optimization phase. Use reporting format of the optimization phase. Introduction to surveillance. Surveillance system consists of the tools, procedures, people, and structures that generate information on case and disease, which can be used for planning, monitoring, and evaluating malaria control programs. The people include decision makers, staff, patients, and communities. The procedures include case definition, reporting frequency, pathway of information flow, data quality checks, data analysis, mechanisms for reviewing performance, method for and frequency of disseminating results, using data for making decisions. The tools include report forms, tally sheets, register, patient cards, dashboards, computer hardware and software, documentation and training materials. The structure includes the way in which staff are organized to manage, develop and use the system. Introduction to surveillance. An effective malaria surveillance system enables program manager to identify the area or population groups most affected by malaria, identify trends in cases and diseases that require additional intervention, example epidemics and etc. Assess the impact of control measures. Introduction to surveillance. The design of malaria surveillance system depends on 2 factors. 1. The level of malaria transmission, and the second is the resources available to conduct surveillance. In the initial phase of control, there are often so many malaria cases that it is not possible to examine and react to each confirmed case individually. Rather, analysis is based on aggregate number and action is taken at population level. As transmission is progressively reduced, it becomes increasingly possible and necessary to track and respond to individual cases. Malaria surveillance in different transmission settings and the phase of control. Transmission. Parasite prevalence 2 to 9 years. Control phase high and moderate, less than 10%. Low, greater than. The first one is greater than 10%. Low, less than 10%. Elimination phase, very low. Incidence, case and disease common and concentrated in less than 5 years. Low. Case and disease has common distributed according to mosquito bite exposure. Very low. Case sporadic. Incidence, limited temporal variation. Limited geographical variation. Low. Transmission, variable within and between years. Risk of epidemics. Geographical heterogeneity concentrated in marginal population. Fevers. Proportion of fevers due to malaria relatively large. Proportion of fevers due to malaria small. Proportion of fevers due to malaria very small through may be high in certain foci, respectively. Healthy facility attendance, high proportion due to malaria, efficient mortality and case reduction, very low. Vision, to see malaria-free Ethiopia goal by 2030 to eliminate malaria nationwide. Objectives, to reduce malaria case incidence to 0 by 2030, to reduce malaria mortality rate to 0 by 2030, by 2030 and beyond, to prevent re-establishment of malaria in all malaria-free districts. Question, how do we know the achievement of this? Answers through surveillance. Definition of key terms. Definition of key terms. Case detection. Case detection, one of the activities of surveillance operation involving a search for malaria case in a community. Note, case detection is a screening process in which indicator is either the presence of fever or epidemiological attributes such as high risk situation group. Infection detection requires use of diagnostic tests to identify asymptomatic malaria infection. Definition of key term. Suspected malaria, patient illness suspected by a health worker to be due to malaria. The criteria usually. Definition of key terms. Case detection, one of the activities of surveillance operation involving a search for malaria case in a community. Note, case detection is a screening process in which the indicator is either the presence of fever or epidemiological attributes such as high risk situation groups. Infection detection requires use of a diagnostic test to identify asymptomatic malaria infections. Definition of key term. Suspected malaria, patient illness suspected by a health worker to be due to malaria. The criteria usually include fever from residents in malarious area and fever with a history of travel to endemic areas. For those residing in non-malarious area, all patients with suspected malaria should receive a diagnostic test for malaria by microscopy or a rapid diagnostic test. Definition of key term. Presumed malaria, case suspected of being malaria that is not confirmed by a diagnostic test. Confirmed malaria case or infection in which the parasite has been detected in diagnostic test, example microscopy, RDT test or a molecular diagnostic test. Definition of key term. Hot spots, geographically discrete household or group of households that maintain malaria transmission throughout the year at significantly high rates than their surroundings. Definition of key term. Focus or foci, a defined circumscribed locality situated in a currently or former malarious area containing the continuous or intermittent epidemiological factors necessary for malaria transmission. Foci can be classified as endemic, residual active, residual non-active, cleared up, new potential, new active, pseudo. Focus or foci classification recommended in the framework for malaria elimination. Classification. Active. Definition. A focus with ongoing transmission. Operational criteria. Indigenous cases have